Have you ever felt like you were suddenly thrown into a whirlwind of fear, your heart pounding, your breath catching in your chest? This could be a panic attack. Panic attacks are more common than you might think. Millions of people experience them, and it's crucial to understand that you are not alone. Recognizing the signs of a panic attack is the first step toward effectively managing and overcoming these often terrifying experiences. Panic attacks can be scary, but they are not dangerous. They are your body's natural response to stress or fear, a bit like an exaggerated false alarm. When you understand what's happening, you can begin to regain control. The journey starts with recognizing the signs. This essay will equip you with the knowledge and tools to identify, understand, and cope with panic attacks, taking the first step towards reclaiming your peace of mind. Imagine feeling like you're having a heart attack, but it's not your heart, it's your mind sending distress signals. This is the terrifying reality of a panic attack. The urgency to recognize these attacks stems from the debilitating fear and discomfort they can cause. Early identification allows you to take immediate steps to manage the symptoms and regain a sense of control. The sooner you recognize what's happening, the faster you can implement coping mechanisms. Untreated panic attacks can significantly impact your quality of life, leading to avoidance behaviors, increased anxiety, and even depression. Recognizing the signs early on can help prevent these potential consequences. For far too long, mental health issues like panic attacks have been shrouded in stigma and shame. Many suffer in silence, afraid to seek help or even talk about their experiences for fear of judgment. This is why it's crucial to break down these barriers and create an open dialogue about mental health. Recognizing panic attacks for what they are, a medical condition, is the first step in dismantling the stigma. It's about understanding that experiencing panic attacks doesn't make you weak, flawed, or broken. By increasing awareness and understanding, we can create a more compassionate and supportive environment for individuals who experience panic attacks. Remember, seeking help is a sign of strength, not weakness. Let's work together to break the stigma surrounding panic attacks and create a world where mental health is treated with the same importance as physical health. One of the most common and alarming symptoms of a panic attack is a racing heart. It feels like your heart is going to beat out of your chest, a frantic drumbeat against your ribs. This rapid heartbeat, known as tachycardia, is your body's natural response to stress. While unsettling, this racing heart is not harmful in itself. Your body is trying to protect you from a perceived threat, even if that threat is not physically present. Understanding this can help lessen the fear associated with the symptom. However, the intensity of the sensation can be extremely frightening. It's easy to misinterpret this as a heart attack, which can further escalate the panic. This awareness helps differentiate between a panic attack and a cardiac event. Along with a racing heart, chest pain, and shortness of breath are common physical symptoms of a panic attack. These symptoms can be so intense that it's easy to mistake them for a heart attack, further fueling the cycle of fear. The chest pain might feel like tightness, pressure, or a sharp stabbing sensation. It's important to remember that chest pain during a panic attack is often caused by muscle tension and hyperventilation. Recognizing these sensations as part of the panic attack rather than a separate medical emergency is essential. While it's crucial to seek medical attention if you experience any chest pain to rule out a cardiac event, understanding the difference between panic attack symptoms and heart attack symptoms can provide some reassurance. Panic attack chest pain is usually sharp and localized, while heart attack pain is more likely to be a crushing pressure that radiates to the arms, jaw, or back. The physical symptoms of a panic attack can extend beyond the chest and heart. Many individuals experience dizziness, lightheadedness, or even nausea during a panic attack. These sensations are often linked to the changes in breathing and blood flow that occur when the body goes into fight or flight mode. When your body perceives danger, it prioritizes blood flow to the muscles, preparing you to fight or flee. This redirection of blood flow can leave you feeling lightheaded, dizzy, or even faint, The feeling of nausea can stem from the same physiological changes, as well as the body's natural response to stress and anxiety. Recognizing them as part of the panic attack can help you stay grounded and avoid further escalating the fear response. Trembling and sweating are additional physical symptoms that can manifest during a panic attack. These symptoms are directly related to the surge of adrenaline that courses through your body during the fight or flight response. Adrenaline prepares your body for action, increasing heart rate, blood flow to muscles, and sweat production. You might find your hands shaking, your legs feeling weak, or your entire body trembling. Sweating, particularly in the palms, forehead, or underarms, is another common physical manifestation of the body's stress response. These physical symptoms can be incredibly unsettling, making you feel out of control and adding to the overall feeling of panic. Acknowledging these physical symptoms as part of the panic attack, rather than a sign of something more sinister, is a crucial step in managing the fear and anxiety associated with these episodes. The grip of fear. Understanding the emotional landscape. While the physical symptoms of a panic attack are often the most noticeable, the emotional and psychological components can be even more terrifying. At the heart of a panic attack lies an overwhelming surge of fear that can feel paralyzing. This fear often appears suddenly and without warning, making it even more difficult to manage. It's not just everyday worry or stress, it's an intense primal fear that something terrible is happening or is about to happen. Imagine feeling like you're in mortal danger, even though there's no apparent threat. Your mind races, searching for an explanation, but the fear itself becomes the focus, amplifying the other symptoms. Understanding that these intense emotions are hallmarks of a panic attack is crucial. Recognizing the fear for what it is, a symptom of the panic attack rather than a reflection of reality, can be a powerful step in regaining a sense of control. Detachment and derealization. Navigating a world gone strange. Panic attacks can also trigger feelings of detachment and derealization, creating a surreal and unsettling experience. Detachment, also known as depersonalization, is a sense of being disconnected from yourself, as if you're watching yourself from outside your body. Derealization, on the other hand, is a feeling that your surroundings are unreal or dreamlike. This disconnect from reality can further escalate the fear and anxiety associated with the panic attack. Imagine walking down a familiar street, but everything seems off, like you're in a movie set rather than real life. It's crucial to remember that these feelings, while disturbing, are temporary and part of the panic attack's physiological effects. The fear of losing control. Confronting the unknown. One of the most terrifying aspects of a panic attack is the fear of losing control, both physically and emotionally. The sudden onset of intense physical symptoms, coupled with overwhelming fear, can make you feel like you're on the verge of a complete breakdown. Some individuals might worry about fainting in public or having a complete emotional outburst. This fear of the unknown can be paralyzing, making it difficult to think clearly or rationally. It's important to remember that panic attacks, while intensely uncomfortable, are not dangerous in themselves. Recognizing that these fears are symptoms of the panic attack, rather than accurate predictions of what will happen, is a crucial step in managing the experience. The experience of a panic attack can be so distressing that it often leads to anticipatory anxiety, a constant fear of having another attack. This fear can become a self-fulfilling prophecy, increasing anxiety levels and making you more susceptible to future panic attacks. You might start avoiding situations or places where you've had panic attacks before, fearing that they will trigger another episode. This avoidance behavior, while seemingly protective, can actually worsen the anxiety in the long run. It reinforces the belief that these situations are dangerous and that you're unable to cope with the anxiety. Breaking free from this cycle requires addressing the root cause of the anxiety and developing coping mechanisms to manage the fear. Remember, you are not alone in this journey, and there is help available to reclaim your life from the grip of panic attacks. The physical sensations of a panic attack, racing heart, chest pain, shortness of breath, can be so intense that it's easy to mistake them for a heart attack. This confusion is understandable, as the symptoms overlap significantly. However, knowing the difference is crucial, as it can dictate the urgency of seeking medical attention. While panic attacks are not life-threatening, heart attacks require immediate medical intervention. Panic attack chest pain is often described as sharp, stabbing, or localized to a specific point. Heart attack pain, on the other hand, is more likely to be a heavy, crushing pressure that radiates to the arms, jaw, back, or neck. If you experience these symptoms, especially if you have a family history of heart disease, it's essential to call 911 immediately. Panic attacks can occur as isolated incidents, or they can be part of a larger anxiety disorder, such as panic disorder or generalized anxiety disorder, GAD. Understanding the difference between these conditions is crucial for proper diagnosis and treatment. Panic disorder is characterized by recurrent, unexpected panic attacks, followed by at least 1 month of persistent worry about having another attack or a significant change in behavior related to the attacks. Generalized anxiety disorder, GAD, involves excessive worry and anxiety about various aspects of life, such as work, health, finances, or relationships. People with GAD experience chronic, persistent anxiety that can interfere with their daily functioning. Section 3. Beyond the everyday, differentiating panic attacks from other disorders. While panic attacks are often associated with anxiety disorders, they can also be triggered by other medical conditions or substances. Certain medical conditions, such as hyperthyroidism, heart arrhythmias, and respiratory illnesses, can mimic the symptoms of a panic attack. Similarly, caffeine, nicotine, and some medications can trigger panic attacks in susceptible individuals. Therefore, it's crucial to seek a comprehensive evaluation from a mental health professional to determine the underlying cause of your panic attacks. Section 4. Seeking clarity. The importance of professional evaluation. If you're experiencing recurrent panic attacks, or if your anxiety is interfering with your daily life, it's crucial to seek professional help. A mental health professional, such as a therapist, psychologist, or psychiatrist, can help you understand your symptoms, determine the underlying cause, and develop a personalized treatment plan. During the evaluation, the mental health professional will likely ask about your medical history, family history of mental health conditions, and any medications or substances you're currently using. This professional evaluation is essential for accurate diagnosis and effective treatment, putting you on the path to recovery and reclaiming your peace of mind. Section 1. Riding the Wave, Practical Tips for Managing Panic Attacks. When a panic attack strikes, it can feel like you're caught in a riptide of fear, your body and mind hijacked by intense sensations. But like a surfer, you can learn to navigate the choppy waters of a panic attack. The first step is acknowledging what's happening. Resist the urge to fight the panic. Accept it and remind yourself it's temporary. This can be grounding. Next, focus on your breath. Slow, deep breaths can calm your nervous system. The power of breath-mastering breathing techniques for calm. Breathing techniques are invaluable tools for managing panic attacks. They provide a tangible way to regain control over your body's physiological response to fear. One effective technique is diaphragmatic breathing, also known as belly breathing. This involves breathing deeply into your abdomen rather than just your chest to slow your heart rate and reduce feelings of anxiety. To practice diaphragmatic breathing, find a comfortable position, either sitting or lying down. Place one hand on your chest and the other on your abdomen, just below your rib cage. Inhale slowly and deeply through your nose, feeling your abdomen expand outward. Your chest should move very little. Hold your breath for a moment, and then exhale slowly and completely through your mouth, feeling your abdomen contract inward. Continue this breathing pattern for several minutes, focusing on the rise and fall of your abdomen. With practice, diaphragmatic breathing can become a powerful tool for calming your nervous system and reducing the intensity of panic attacks. Grounding techniques, also known as sensory grounding, are powerful tools for managing panic attacks by helping you reconnect with the present moment. These techniques involve focusing on your senses, sight, sound, touch, taste, and smell, to ground yourself in the here and now, shifting your attention away from the overwhelming fear and physical sensations of the panic attack. One simple yet effective grounding technique is the 5-4-3-2-1 method. Start by identifying 5 things you can see in your surroundings. Describe them to yourself in detail, noticing their colors, shapes, and textures. Then identify 4 things you can touch, focusing on the sensations of pressure, temperature, and texture against your skin. Next, identify 3 things you can hear, paying attention to the volume, pitch, and rhythm of the sounds. Then, identify 2 things you can smell, noticing the subtle nuances of each scent. Finally, identify 1 thing you can taste, savoring the flavor on your tongue. This methodical engagement of your senses can help anchor you to the present moment, providing a sense of stability and control amidst the chaos of a panic attack. Challenging anxious thoughts, reframing your perspective. Panic attacks are fueled by negative, distorted thoughts. These thoughts might center around catastrophic possibilities. Reframing these thoughts is crucial in managing panic attacks. Identify and label negative thoughts as they arise. Challenge their validity by asking for evidence. Reframe them into a more balanced perspective. Shift your thoughts from fear-based to rational ones. Regain control and reduce panic attacks over time. While self-help strategies can be incredibly effective in managing panic attacks, there are times when seeking professional help is crucial. Recognizing these signs is essential for ensuring you receive the appropriate support and guidance to navigate this challenging experience. If you find that panic attacks are significantly impacting your daily life, interfering with your work, relationships, or overall well-being, it's a clear indication that professional help is warranted. Similarly, if you're experiencing frequent panic attacks multiple times a week or even daily, it's essential to reach out to a mental health professional. Another red flag is if you're experiencing anticipatory anxiety, a constant fear of having another panic attack, which can lead to avoidance behaviors and restrict your life significantly. Additionally, if you're struggling to manage the emotional toll of panic attacks, experiencing feelings of hopelessness, helplessness, or depression, seeking professional support is paramount. Seeking professional help for panic attacks opens the door to effective treatment options, empowering you to regain control over your mental health. Cognitive behavioral therapy, or CBT, is a common approach. It helps identify and change negative thought patterns. Medication, like SSRIs, can also be valuable. Always use medication under professional guidance. Combining therapy with lifestyle changes is most effective. Finding the right treatment is an individual journey. Living with panic attacks can be challenging, but they are manageable. You are not defined by your anxiety. Recognize the signs and symptoms and implement effective coping strategies. Recognizing a panic attack for what it is, a temporary surge of intense fear, is the first step. It's not a sign of weakness. It's your body's natural response to stress. Techniques like breathing exercises and grounding can help calm your nervous system. With practice, you can develop coping mechanisms to face challenges with confidence. Perhaps the most important message to take away from this discussion is that you are not alone in this journey. Panic attacks are incredibly common, affecting millions of people worldwide. There is no shame in seeking help, and in fact, it's a sign of strength and self-awareness. Reaching out to a mental health professional, such as a therapist, counselor, or psychiatrist, can provide invaluable support, guidance, and evidence-based treatment options. These professionals can help you understand the root cause of your anxiety, develop personalized coping strategies, and navigate the challenges of living with panic attacks. Remember that recovery is a journey, not a destination. There will be ups and downs, good days and bad days. Be kind to yourself, celebrate your progress, and don't hesitate to reach out for support when you need it most. You are stronger than you think, and with the right tools and support, you can overcome the challenges of panic attacks and live a life filled with joy, purpose, and peace of mind.